Right, let us start now. Kayena vacha chittena pamadena maya katang achayang kamame bante buri panya tathagata kayena vacha chittena pamadena maya katang achayang kamame dhamma sanditika akalika kayena vacha chittena pamadena maya katang achayang kamame sangha supatipana anuttara sadhu. Namo tassa bhagavato arahato samma sambuddhassa. Buddhang saranang gacchami. Dhammang saranang gacchami. Sanghang saranang gacchami. Tisarana gamanang paripunang panatipata veramani sikkhapadang sammadiyami. Adina dana veramani sikkhapadang sammadiyami. Abrahmacharya veramani sikkhapadang sammadiyami. Musawada veramani sikkhapadang sammadiyami. Sura meraya majja pamadatthana veramani sikkhapadang sammadiyami. Vikala bhojana veramani sikkhapadang sammadiyami. Nacha Gita Vadita Visuka Dasana Malaganda Vilepana Dharana Mandana Vibhusanatana Veramani sikkhapadang sammadiyami. Uchasayana Mahasayana Veramani Sikkhapadang samadhiyami. Idang me silang magga pala jnanasa pacayo hotu appamadena sampadeta sa. All right. That is Suttam guided Maranasati, contemplation on death. We sit here. Let go of all the vipassana objects. Keep the mind open, calm, peaceful. Let the body relax. Let the body relax, free from all the tension, tiredness. Relax from top of the head. Relax the forehead, the face. Relax the neck and shoulders. Relax the arms, chest, stomach area. Relax the spine, relax the back, down to the hips, down to the buttocks, on the thighs, on the calf, the knees, ankles, the soles and toes. Relax the whole body. My life is uncertain. My life is uncertain. My death is certain. My death is certain. My death was sure to come. I do not know when it will come, where it will come, or how it will come. But I know that it will come. As long as I am in this samsara, I will surely meet with death. I will not be able to run away from death. As long as I am in this samsara, I will meet with death. I will not be able to be free from death. When death comes, it will rob everything away. Whatever my possessions, my wealth, my loved ones, it will rob everything away. And definitely my life. So today I make the utmost effort to develop the mind, to develop my wholesomeness, to develop dana, sila, bhavana, and to give up, to abandon all the unwholesomeness, akusala. So today I make the utmost effort to develop my mind, to develop the wholesomeness, and to abandon all the unwholesomeness. My life is uncertain. My life is uncertain. But my death is certain. I do not know when it will come, where it will come, or how it will come. But I surely know that when it comes, it will take everything away. It robs my wealth, my possessions, loved ones, my life. Before death comes, let me develop the utmost effort to develop the mind so that I can be free from all this cycle of birth and rebirth, free from the clutches of death. May I develop the wholesomeness and abandon all the unwholesomeness. All the people around me, whether they are my fellow yogis, teachers, monks, nuns, whether my loved ones or my enemies, or to all those whom I do not know. For they too subjected to death. Life is uncertain. Death is certain to all of them. They too do not know when death will come, or where it will come, or how it will come. When death comes, it will rob everything away. It will rob them from their possessions, from their wealth, from their fame, from their gains, and finally robs their life. Reflecting on that too, may I too be able to make the utmost effort May I able to make the utmost effort to stir up the mind, to develop the mind until enlightenment or nibbana is achieved. Before death comes and takes everything away. So today I arouse the sense of urgency. An urgency to develop the mind, to progress until the enlightenment is seen or realized. Before death takes everything away. So my life is uncertain. My death is certain. Life is uncertain, and death is certain. Life is uncertain, and death is certain. And slowly we let go. We let go of the reflection. Bring the attention back again to the body. Feel the rise and fall of the abdomen. Feel the sensation of the body. And then we can slowly open our eyes. Right. Yesterday we were discussing on the pain. Yes, pain, unpleasant bodily feelings. That I said that the unpleasant bodily feelings, even sometimes there are devotees or there are practitioners, even before they start off with this meditation, they already have certain type of wrong idea or wrong views or wrong thinking. They attach the view that life is already dukkha, is full of suffering. What for we come to meditation and we see more suffering? To them, it seems very logical. After all, we want to look for calm and peacefulness and happiness. But we don't realize that all these things is just another moha or delusion is connected with all this type of so-called logical thinking. We don't realize that what is behind it, what are those attachments and craving behind it. It's not about we want to make you suffer. It's because we want you to see things as they are. And what things as they are, or phenomena as they are dukkha. So when we do not want to see what is dukkha, we do not want to see what is dukkha, we think we know what is dukkha because we go through a daily life of all these problems and that problem. We see people dying, we see people get sick, and so on. We see ourselves dying, we see ourselves getting old. We think we know all the dukkha, and yet we still go on in this cycle and birth and rebirth. We still really do not know. So here the first thing, as I said, the perception or the thinking itself is already preventing the yogi from seeing the truth. And there are many people like that. So hopefully you're not one of it. The next one, as I said, there are again perception on paying attention to the dukkha. When you're paying attention when you're walking or when you're sitting, especially sitting, then when the pain comes in, sometimes certain yogis, they tend to do it in this way. They tend to not. And then they want to make it to go away because they want things to happen as what they want, not to see them as they are. They really have that sort of thinking. Because of that sort of thinking, it prevents you to note to see the true nature of the pain, the true nature of the dukkha. Then there are also yogis, as I said, they are only tolerating the pain. Although they can sit with the pain for a number of hours, but they are not watching the pain. They just only sit there and grit their teeth and wait for the time to finish, up to the hour or 2 hours. They're not really doing anything. They feel triumph when they come out from it because it feels good, 2 hours you can sit. Uh, Now, the other yogi, another type of yogi is when they take up these painful feelings, they don't want to see the painful feelings. They don't want to see the painful feelings because they know that when you pay attention to the feelings, all these type of feelings, the feelings can be overwhelming, very strong, very to see them as excruciating, very painful. Uh, Uh, So with that experience, sometimes they didn't know their fear. They didn't know their they didn't know their fear, or they didn't know their uh, aversion that comes together with it, with the pain. Then they sort of like becoming a habit. Then it gets stuck into them. So in the future, when they meditate, the whole mental habit comes in. The moment they touch, the pain arises, fear or aversion arises. Then what they do is that they try to keep the pain far away mentally, you know. So when you pay it to make this thing far away, you actually not scrutinizing the pain anymore. When you don't scrutinizing in the sense of paying attention to what is going on, then that time you're not seeing the pain as they are. You may be a bit mindful there, not to say that you're not mindful, but you're not sharp, you're not precise. You just let it be like that. Uh, and sometimes this type of method, there are some vipassana centers to teach you to do like that. Uh, I've seen this before. When it comes to pain, just be there with the pain. Just like, sayang the pain, be nice, be nice with the pain. Like that. Just accept, accept with the pain. You totally accept the pain, but you're not scrutinizing what is the true nature. So if you do like that, you just be gentle with the pain. You thought, just be gentle with the pain. Then you don't feel much pain. You don't feel much pain. Because your mind is already going far away from it now. Now, also, not this is just again these are perception. Yesterday I stopped under somewhere there. Now there are also other perception also. Once in a while, some yogis to note the pain until to make the pain to end the pain. They don't want the pain to go away, That's different from the first one. The first attitude one is that you not you want the pain to go away. But this time, another type of yogi is to not the pain, but they want it to end. They watch. How they want to see how exactly it disappear. How exactly it disappear? Because again, sometimes you listen to Dhamma talk, then you may hear, oh, there's arising, there's sustaining, there's disappearing, which I talked about that last week. But then sometimes yogis tend to, they understand it slightly differently. Then they waiting the pain to end. They not, they still cannot, they cannot. But behind it, they want the pain. They are waiting for the pain to end. Yeah. They can still tolerate the pain. The first one, they don't really able to tolerate the pain, but this one they can tolerate the pain and they want the pain to end. So slightly a little bit different perception, but still the same. You want things your way. So that also is not right. There are also, over the years, when it comes to pain, yogis do all kinds of thing about the pain. Yeah. Sometimes the yogi says, "That's so painful already. May you be well and happy. May you be free from all suffering." No, they tell the pain like that. They put in a way that the pain is like a being like that. Then may you be free from suffering. May you be happy. May you be well. As I said, this one is just like you're putting a a plaster onto it, just to don't want to feel the pain. Yeah. Once in a while, there are yogis doing it. Even I mentioned this also, they will do it also. So one of these things. Another thing. Another thing about usually normally with the pain is that sometimes when the yogis don't have much experience with this vipassana meditation, and then when they come in, they meditate with this one, with the pain arising. Then they feel that they are very attached to their bodily health. They are attached to their bodily health and the bodily well-being. They're afraid that this type of pain will give them some form of injury. Yeah? Once in a while, there are doctors come to meditate. Not to say all, but once in a while I meet with this thing. Because they are so involved day in, day out, involved with all this bodily pain, all these bodily diseases and so on, and with their whichever particular their discipline. So to them, it is so strong that whenever you have pain, it means bodily problem already. It means bodily problem already. So you must not go through all this type of pain because pain means problem. Pain means problem. And then they're attached to whatever they have, then they cannot shake away from this type of perception, very strong perception in them because it's their career. I mean, they're dealing with these type of things. So here, with that, and also of course there are also devotees also or yogis also tend to think of their numbness or their pain here and there is because of their nerve problem, because of their blood problem, because of get stuck here and there, all this concept. All this concept. And you will definitely think of this one way or another when pain becomes excruciating. You begin to think of it when it becomes excruciating. Before that, just before that, when things are good and clear, you can still note it very nicely, very clearly. When it passed through the threshold already, then you see the thoughts all coming up. That also you have to learn to manage them. And I know a number of you can manage the first part. You can note the part because the pain is not that painful yet. You can still able to tolerate. But the next part is when you pass through that threshold, when your thoughts begin to have a lot of thinking, a lot of all kinds of thinking coming in, you be careful. This part also, sometimes it can form certain habit. As I said, if those people who are fearful with the pain, if you don't check on it, then it becomes a habit. Another part over here also, this part also is where sometimes yogi also tends to move the body in order to release the pain. It may not move a lot, but just a little bit just to move Okay, just put it down. You know, and suddenly you can feel the whole leg got sensation again. Sometimes it gets a lot of numbness. You your finger touch also no feeling anymore. Uh, yeah, we tend to do that once in a while also. Yeah, and then the problem is that if once in a while you do it, it's not really a problem. But the problem, it becomes a habit. It becomes a habit in the future sitting. Every small little pain, you don't like it, and therefore the first thing, subconsciously, you will move the body. Yeah, you will move the body. Yeah, just to release that pain. Yeah. Now, if you are a beginner into this meditation, which we don't expect you to be right now, you are not supposed to be a beginner right now. You cannot, beginners supposed to come in from the first day of the retreat. Now, but the word beginner is very subjective. Even sometimes they attend a few retreats. They think that they already attend a few retreats, but they are still very much a beginner. Anyway, anyway, in the beginning part, tolerating the pain is very difficult. Yeah. Why? Because the mindfulness is not strong. It's not because you don't have enough patience. Because no matter even how much patience you have in the world out there, when it comes to this meditation pain, then you're not able to sit with it. Yeah. So the patient comes in with a lot of, especially the mental effort. The mental effort, it prevents the mind from going into a lot of aversion and overthinking and whatnot. Now, other words, the effort when it comes in, it push your threshold a little bit further, a little bit more, so that you can able to tolerate the pain. When you tolerate the pain, you can able to scrutinize what is going on with the pain. So in the beginning, it's just this little. So you make an effort, you get more and more and more and more and more. Yeah. So how do we do that then? So how do we going to push this thing getting further and further and further until we can able to sit? Even the whole hour it comes in with pain, until ting 1 hour later, then you can able to sit with it and pay attention with it. Yeah. It takes a lot of training, and also not only just effort is needed, but also the progress of the insight also, it's important. Yeah. Now, the technique of paying attention to the pain, the technique of paying attention to the pain is just as similar like everything else. When the pain becomes predominant, when the pain becomes predominant, you put your attention there. Drop whatever that is this one and you put attention there. And normally, in the beginning of the practice, pain is the predominant one. Uh, Sometimes some yogis, when they come into interview room, they are so excited to report the pain and they forget about their rising and falling. Although pain sometimes is in the last 20 minutes, they don't tell me what is the beginning of their meditation sitting. They tell me what's the ending. Then after that, they go to the center. Then after that, they go back to the ending again. Then after that, they forget about what they do in the beginning. Only I have to ask them, so where's your rising and falling? Yeah, rising and falling. Then only they start talking because they're so excited about their pain. No, you don't do like that. When you're reporting, and it comes in with reporting, there's always a chronological factor involved. In the beginning, if you start off with the pain, then report with the pain, it's fine. If you start off with the rising and falling, then report with the rising and falling. Then after that, report what's happening in the middle, what's happening in the end. Generally, at least we know how's your progression of your meditation take place within that particular hour, more or less. Yeah? So, so here, back to the pain again. So the pain becomes predominant. Your job is to drop everything and pay attention to the pain. Now, there are two parts of noting the pain. This is called two parts of noting the pain. But in the beginning part of it, as I said, the first thing is that we learn to accept the pain as it is. Before even we note the pain, we have to learn to accept the pain as they are. A lot of people, they reject the pain because of whatever their wrong perception that is already connected in the, which I've talked about it. Because if you have that wrong perception, then every time the pain comes in, you are using the same old perception, that wrong perception, in order to trying to overcome or note the pain. Then that problem will spring up again and again. So you must learn to accept the pain as they are. You take note of the pain. They come in a very numb pain, strong pain, pulling pain, whatever it is. So this is the preliminary part of it. This one, the acceptance. Now, when you note the pain, generally we can able to note the pain in a two different way, and both sometimes they come in together. Sometimes you see one of it more clearer. Okay. Now, the two part of the noticing unpleasant feelings is to note its characteristic. Okay, to note its characteristic. That is to say, although it's unpleasant feelings, but there are different types of unpleasant feelings. You know for yourself that you have numb pain, you have pulling pain, you have twisting pain, you have hot pain, you have cold pain, you have spreading pain, you have sawing pain. There's so many types of pain. Now, this is called the characteristic of the pain, of the unpleasant feelings. So you pay attention to those things. Get yourself used to it. Get yourself used to it that this type of pain do arises. Okay. The second part of it is to note its changes. To note its change. The change can be quite as simple as it's growing more and more and more and more and more. It's changing. But the thing is that when we don't accept them, we feel very difficult. But it's the nature. Its nature is to change. So the change, one of it is it gets more and more and more. Sometimes that particular pain, it gets from more, it gets less. But that is quite far and few in between. Usually it's more for you to see. But there are times you will see it will come to its peak, very painful, you able to, and then it slowly finish off. So with all these things, it happens. It's called the change of what is going on. So you pay attention to it. Now the changes sometimes also, it can be like it is not stagnant in one area. Sometimes within an area, it goes more, it goes less. You see, it's that particular characteristic. Now sometimes it spreads. Sometimes it spread to one place, sometimes it spread as you feel that it's like it's moving around. It's moving. The same type of pain is moving. And that also, it's characteristic that you pay attention to how it's going on. Okay. Another characteristic is that it changes from one pain to another pain. It changes from one. Sometimes you note one pain, pulling pain, then pulling pain. After that, it goes into a numbing pain. So from a numbing pain, it goes to another type of pain. Because here is where your mind can able to differentiate from one pain to another pain. And that is crucial. That is important for Vipassana. Yeah? Yeah. So you pay attention to how the whole thing is going through. Yeah? Yeah. Then the pain may not just be at the leg, but can be also at the back, can be itchiness also actually, which is also unpleasant body feelings. Yeah? So sometimes you may notice the pain around the leg area. You can see that this is certain type of pain. Sometimes the pain goes to the back area or sometimes the spine area. That is also another type of pain, but it can be excruciating. Yeah. Sometimes, you meditate, certain pain you can tahan. You can, well, you can know, when certain special pain come in, you collapse. Just collapse. So sometimes that particular pain can be very painful. Yeah? Then if the pain moves around here and there, it moves around here and there, usually you can able to tolerate the pain. Usually. So this is how basically we pay attention to the pain. You take note of its characteristic, then you take note of how it changes. Sometimes the characteristic is quite clear. The changes may not be so clear. It just stay there very strongly. Very strongly, it just stay there. So if you stay there, you just keep on noting it. You keep on noting it. Sometimes it grow more, sometimes it grow less. But sometimes certain pain, although it can be strong, you pay attention to it, but then it got not much activity there. You watch it, and then, wabo. I mean, what is going on? Just stay there only. At that time, other words, you're not too interested with the pain anymore because there's not much activity there. So if it's not much activity there, although it can be still painful, then this time you better switch to another object. Because if you don't switch, then the mind is not going to pay more attention to it. After that, then it starts to go into a lot of thinking already. So if there's activity and it can still able to hold your attention there, then fine. Then pay attention to it. If not, then let it be, and it goes to another this one. Go to another object. Now with the pain also, sometimes pain comes in. You feel it very painful, and you pay attention to it. You thought that you're going to die very soon because it's so painful. But then after that, the bell rings. You're saved by the bell song. Then after that, when you open up your eyes, not so painful. The pain is not so painful. How come when I close my eyes and when I pay attention to it, the pain is it's excruciating. I can't take it. But when I open up my eyes, it's okay. How come I get so difficult about it? Yeah. Now, again here, this is the nature of mindfulness. The mindfulness, when it goes face to face with an object, it tends to expand the object very clearly for you to see. And together, when you scrutinize the object with the precision or investigation of Dhamma, when you take note of it precisely, noticing what is going on, then things become magnified and clear to you. Then, when you stop the meditation, with the bell rings and then you drop everything, Although you're still aware, but then after you get up, it's not that painful. Uh, Not that painful. Uh, so it's just a nature of mindfulness only. Now with this also usually generally we categorize the bodily pain as there's meditation pain, and also there are actually physical, maybe physical pain, a physical injury type of pain. Okay. Now sometimes you may have hurt your knee and you have to sit there with that type of bending. And there's this type of bending, sometimes it can exaggerate all the pain further. The pain can grow even further. And then it can be a problem if you want to stay for the whole 2 weeks, because you're going to be limping while you're walking. It's going to be difficult. So that type of injury, type of pain, you got to be careful. Sometimes there are yogis also, they come with this meditation. They may hurt their spine, the spinal cord, sometimes the lower back, then they have difficulty sitting like what they are doing over here. So these type of people, they may need sometimes a back rest, a certain back rest. Okay, with that, sometimes they do that, or sometimes they have other form of injury that they could not able to sit cross-legged on the floor. They need to find a stool, a chair to sit on it. So nevertheless, there are two parts of it. So the meditation pain and the physical pain. The meditation pain here is usually is what we categorized as when you meditate, you walk or you sit, and then when you stop the meditation, the pain also gone. Then it comes back in the following sitting or following walking or maybe some other time. Okay. The physical ones, it doesn't really go away. So you got to be a bit careful with this physical one. Although finally, feelings are just feelings. Feelings are just, in a way, they are feelings. But how it arises, I mean, with our practice, we should be wise enough, If it's a meditation pain, it's get very strong, you pay attention to it, well and good. Because after that, I still haven't find over the years have any much of a big problem. You don't go back in a stretcher or whatever, It's still okay. So don't worry about that, But the other one, the physical problem one, that you got to be careful. Sometimes also in the interview, I do assess whether the yogi have this type of pain or not. Because if not, sometimes this type of pain can be quite problematic. Now, if you know yourself, if you know yourself that sometimes there are certain injury, it's already there. It's already there. Then you got to be careful. For example, if sometimes let's say you sit your right leg out and your left leg in. Once in a while, if you find that that particular one is not so good, then change left leg out, right leg in. Sometimes with that a little bit minor of changes, it's already able to relieve certain physical pain. Sometimes also, if this type of sitting may not be suitable to you, sometimes even people change to another type of maybe squatting down with a sitting bench. Or sometimes they come in, they sit for, if sometimes they have back problem, sometimes they sit on a chair for a few sittings, then they sit on the floor for a few sittings. So because they don't want to overpressure on that particular area. So this one, somehow or another, you have to figure it out for yourself. What is suitable for that particular type of injury. Because we want you to make sure that you're able to stay for your whole retreat, not halfway because of that particular pain, you have to pack your bags and go back and to see a doctor. And not that will not be very good for all of, not be very good for for your meditation perhaps in the future, and perhaps the fear may comes in also. So try not to go into that area. Uh, Now, in the meditation type of pain, uh, the meditation type of pain, as much as it become painful, pay attention to it. Again and again, pay attention to it, how they change and so forth. What exactly happened to them? It can come in sometimes the pain, shooting pain, perhaps just for a while it disappears. Sometimes it shoots and then it stays there for a long. No matter what happens, stay with it, pay attention to it, with it. Yeah? So you get up after you go for a little bit of walking, all the pain gone, then fine. Yeah, you are still okay. Yeah? Well and good. But if you're not careful, this meditation pain can turn into a physical pain. Yeah, if you're not careful. I ask yogis to sit 1 hour walk, 1 hour sit. But there are yogis doing 2 hours walk, not much of a walking meditation. This is a recipe for physical injury. Or if it's not a physical injury, then it's a mental problem. Not the problem getting mad. Problem is can become some because of something not mindful anymore. You got to be careful. Now, let's look into how sometimes certain pain can turn into a physical pain. One part is that when they sit too long, they keep their mind firmly, sit and grit their teeth there, and they push on it. Although they get up, they feel good, but they don't realize that the pain is already developing there. It's already staying there. The next sitting again, they do it again. Same area, the pain comes up, they sit there for 2 hours, and after a few sitting or so, 1 week or so, or few days or so, then they're going to end up with a lot of, if we're going to stay with it, a lot of injury. The injury is going to be there. So that one you got to be careful. One of the purpose of walking meditation is to relieve the body. With the tension that comes up and the pain that comes up, it takes a lot of strain in the body. So here, walking meditation, especially the first phase, it helps you to relax the body so that you can able to last for the whole retreat. Some people, some yogis are so, so keras, so hard. You tell them, hey, do a bit of first phase. No, slowly. You end up with a lot of tension. Sitting with so much pain already sometimes. You get up and then you don't want to relax and then you quickly you do into that. You end up with a lot of problem. Tell them to walk 1 hour. They already like half an hour, they want to go and sit already. That is another problem, which I'm going to talk about it in a short while also. So here, the pain that we do not want you to becomes from just a meditation pain to a physical pain. So don't sit too long, just enough 1 hour, get up. The second type of how physical meditation pain turns into a physical pain. Another one is where the pain, when you sit, it happens at that same area every sitting. It happened every sitting. Perhaps for the first few days, you get up, walk, no pain. But every sitting, subsequently, every sitting, let's say it's at the buttock there, you sit there, that particular area, that particular type of pain. Then you sit. Next sitting is the same area. Next sitting is the same area. Next sitting in the same area. Sometimes within the number of days, you're going to carry pain in the butt. Uh, and this time also, it's good for you to either to change your cushion a little bit or to change your position of your leg a little bit. Uh, uh, then it's just to relieve that area away. Once in a while, if you go into a long retreat, these type of things you may see that in the long-term yogis. I've seen this before in myself, because I become more smarter already. After one or twice, I know already. It develops into actually a physical pain. Really a physical pain. Yeah, 20 years ago, it developed into a physical pain until I have to go and get injection. Terrible. In Myanmar, whenever you got pain, they don't give you pill. Sekali, they take out the injection and to choke you. Wow. But it relief for a while. But I come back again. Yeah, that was in the how many months into the retreat, still got many months to go. So you see, it does develop into these type of things. But we don't think of going back one. You think a little bit of pain, a bit of sickness, a bit of diarrhea. Oh, bante be liao. Want to go back liao. No, we go one way ticket one. Want to come back only get another ticket. Like that. And how they are supposed to meditate. The pain comes in, you learn to wise up, and after a few trial and error, you get wiser, and then after that, you learn through it now. Learn through it. So all these type of things, we have to be careful because here some of us are in a long retreat. If you're here for the 2 weeks only, perhaps it's not so much. So in the 2 months, 3 months type of retreat, we have to be a bit more careful. So many things just now was going through my mind about pain. But anyway, this is what I'm trying to say. The physical pain, the meditation pain, you just have to, at least generally, on a practical level, we just learn to separate them. We learn to separate them. So meditation pain, as I said, you note them as much as you can. The physical pain one, you got to be careful. Yeah, something I remember about the physical pain. Now, some yogis are very, their faith is a lot, which is admirable, their faith is a lot. So what happened? They want to fight through the physical pain with the mentality. Now, sometimes they read some yogis, they got certain sickness, some cancer or some type of bodily injury, and then they note. The book is only one way telling you. It's not a conversation. But the book is, they read, they do this vipassana and so on and so forth. And then all the cancer cured, all the problem cured. So many years I have that problem, then cured. I mean, what I'm trying to say, not to say that it is not true, but how many percent is true? Maybe this one is only about, let's say, 1,000 yogi, maybe 2 or 3 only. That means That means, let's say, or maybe it'll give you a little bit more, 5%. If let's say 100, maybe to 2 or 3% of the yogi only, like that. A lot of yogis don't go through that. You got cancer, okay? If you got cancer, again, you see, if your ulterior motive, if your motive is just to cure your cancer using vipassana, and if you want to do that, not to say it's not admirable, but again, here, your motive is still very worldly. Although it's suffering, we understand that. I know it's suffering. But I've seen people when they cure their cancer, when they cure their diseases, after that, they don't come back to meditate anymore. They give up. Because that is the whole motive to come for vipassana and just to cure that particular cancer. And then they wrote down there in the books. They tell people. So if you don't able to see through all these type of things, you thought that vipassana is a dharma therapy. And you do that, and that's it. Whereas vipassana over here, what we are doing is to actually to get out of this cycle of birth and rebirth. The cancer is just the ikan bilis only. Although it's problem, it's just only the small little fish only. We want the big one. Ending of the samsara, ending of death and birth and death, not just only the thing only. So sometimes we have to see a little bit more further than that. So as I said, it may not happen to every yogi that you come for vipassana is going to cure your cancer, cure your diseases. There are chances it may happen. I'm not saying totally zero because I've met with people before who actually this thing cured. Yeah, this thing cured. But but let me put it this way. Whatever problem that you have, whether mental or physical problem, if you can still meditate, keep meditating. Because that, if you keep meditating, then whether it's cured or not cured, perhaps Nibbana is able to attain. If it cured, then well and good, Nibbana still able to attain. So whether it cured or not, that you cannot sometimes, it's your own past life karma. How are you going to change that sometimes? Not say all of them, but sometimes your past life karma, you're going to bear up with that particular problem, that particular disease. No matter how much vipassana you're going to have, no matter how much enlightenment you're going to have, it's going to overcome that problem. Hey, the Buddha also got sickness on. So, as I said, we never know. Nevertheless, this physical pain, as I said, just keep pushing through, right? Now, this is one thing. Now, what is the next thing on the pain also is that how we can able to sustain the pain better, clearer, and stronger. As I said here, is the effort. It's the effort that builds up that mindfulness, and we need that a lot of effort because not only just develop that mindfulness, but it's also prevent the aversion from coming in, because that is the nature of patience. It prevents, as I said, 2 or 3 days ago, as I said, one of the 4 types of supreme effort or the right effort. One of it is to prevent the unwholesomeness from arising. Right? One of it is prevent the unwholesomeness from arising. So to prevent means, in other words, your pain is still there, and your anger is still not in yet. Yeah. Your anger is still not in, your aversion is not in yet. So you can able to drag it out for a longer period of time. So what do we do? So where does effort, how to arouse a lot of effort? Again, here through walking meditation. And the walking meditation here, specifically on the slowest walk. Your slowest may be 3 phase, 4 phase, 5 phase, doesn't matter. As long as you pay attention to it precisely. That area, when you pay attention to it precisely, clearly, it develops a lot of effort. It develops a lot of effort. Then, precisely noticing at that thing, and also the second one is how much time you spend into it, into that noting of the lifting, pushing, dropping, or the slowest phase that you do. That one also is crucial because some yogis, they don't like to do this lifting, pushing, dropping, or they don't like to do walking meditation at all. So when they do that, every time pain comes in, the whole mind collapse. Cannot take it. When it comes with all kinds of thoughts and thinking. So if you notice that you're sitting, a lot of pain, so this time you better buck up with your third phase walking meditation and spend on it a little bit longer, sometimes like half an hour up to 40 minutes if you can take it. Yeah. It's up to about that. And then the first 20 minutes or so, learn to relax the body. Relax the body first. Relax, lifting, right step, left step, lifting, push, lifting, dropping, Learn to relax the body. As you begin to slow down, at that time you pay close attention to what is going on. With that, you do it for a few times in the walking, then you go in to see in the walk during the sitting, when the pain comes, you can able actually to withstand the pain for a longer period of time. Not to say that from, you can withstand 5 minutes, suddenly you can withstand 1 hour. No, not so fast. Maybe from 5 minutes, you can withstand for 15 minutes. 15 minutes, it can go into longer and longer and longer. Yeah, it's not a miracle, So it's going to be a little bit before all the aversion before it comes in. So you pay attention to it. You take note of your walking meditation, and that is a very crucial part. The second part, the second area, it's where you're noting of your daily activities, especially when the body is in the relaxed position. In the relaxed position, that is to say, when you are sitting down, eating, for example, the body is in the relaxed position. So in the relaxed position, pay attention to it more carefully. The chewing, swallowing, how the chewing take place, the scooping and everything, drinking. Pay attention to the taste. Don't let the mind runs. Come back to the body, the sensation, again and again. For half an hour, if you can do that, it builds up on that effort again. And then with all these things also, sporadically, a little bit here and there, in the daily activities, you pay attention to a bit more precisely. A little bit more precisely, just for 15, 20 seconds, 30 seconds, or even 1 minute. Then after that, you go a little bit faster. Then you slow down again on some activity, like opening a door. Just go do it slightly more slower than before. Pay attention to how you touch, warm, cold, the pressure, and so on. Take note of those things. Then after that, then you do a bit faster. Perhaps you want to sit down onto the bed. Then you note intention to sit. Then slowly you're going down. Something like that. You see, all these small little things that you pay attention to, it builds up upon it. So when it comes to your pain, then you can able to tolerate the pain longer period of time, and then here you can able to see what the changes of what the pain is going through. This part here is going to turn a lot of things. In fact, not only you are able to note what is going on, but the faith, the confidence that you're able to note the pain also increases. Because from fear, sometimes you dare not watch it, then it turns into, hey, actually I can do it. But of course, maybe for a period of time, but you're still happy. You know that you are doing longer than before. You know that you are doing something. This is how we build up a little bit by little bit. So we take note of this type of way of how we note the pain. So the daily activities, and also especially the walking, especially the third phase walking meditation, this is a very crucial aspect of the this one. Now, the pain here, whatever the bodily feelings that we are going through it, okay, they are just only what we call the dukkha only, the unpleasant type of feelings. But the dukkha has few more layers behind it some more. Underlying it, there's another type of dukkha. That dukkha comes with change. And another below it some more, there's dukkha comes with conditioning. So what you see a lot of dukkha is already on top of you, the three-layered pork, three-layered meat. So what we see this one is over here, but there are deeper aspect of dukkha that's going to test you through even more deeper, even more difficult. And they may not come is as your buttock pain, back pain, head pain, and so on. But it's going to come in together with your feelings and your emotions and so on. So we're going to talk about that maybe not tomorrow. Tomorrow no Dhamma talk. So the next Dhamma talk will be on Thursday. We're going to talk on another aspect of effort. This time we're going to talk about effort. We're going to talk about it, how not to over push your meditation. Which is also another area of effort. Okay, we'll stop here for tonight and we'll continue on Thursday. Idang me bawanang nibbanasa pachayo hotu. May my mental cultivation be a condition for the realization of Nibbana. Imang no punya bagang sabba satanang dema. We share these merits with our departed ones, with all beings and all the devas. Sabbe satta sukhi hontu anumodantu. May all beings be happy. May they rejoice in these merits. Sadhu, sadhu, sadhu.